Okay, my dear students, welcome to today's lecture series. In this lecture, we try to cover the meningitis, which is one of the most common central nervous system infections. So we'll try to cover this meningitis with part 3 in this lecture, which is the part 1. We will try to cover the introduction part, which includes trying to see the anatomic part of the meninges, and we'll try to see the types of meningitis, then epidemiology and the etiology, different etiologies about meningitis, and then we will see the pathophysiology and risk factors in this part 1 lecture series. So with this, let's go to introduction part. So meningitis, by definition, it is inflammation of the leptomeninges. Leptomeninges means you can see from this figure. This is the parts, the layers of the meninges. As you see from this picture, these are the the bottom three are the layers of the meninges. This is the pia mater. This is the arachnoid matter, and this the third layer, which is the dura mater. So, by definition, when you say leptomeninges, it is both. It involves both the arachnoid and the pia mater. So, when you say meningitis, it is inflammation and infection of both the arachnoid and the pia mater. And the upper ones are these are the layers of the scalp in general, starting from the skin, the aponeurosis below the skin. Then you see the periosteum, which covers the bone, and then finally there is a bone. Under the bone, you will see the outer first layer of the meninges, which is the dura mater, and then the next two layers, the arachnoid and the pia mater. The last two layers, or the inner two layers together, you call them leptomeninges. So meningitis, by definition, is inflammation of the leptomeninges. So meningitis can be infectious or non-infectious causes. We have a lot of infectious causes that may result in meningitis, like bacteria, viral infections, tuberculosis infections, and other like parasitic infections are also possible to cause meningitis. Non-infectious causes like autoimmune conditions, autoimmune inflammatory conditions, and also sometimes tumorous conditions may result in inflammation of the meninges when it ruptures. There could be possible inflammatory process in the meninges that may result in meningitis. So, meningitis is a medical emergency. It needs immediate management of the patient's condition. So, when you come to the types of meningitis, we'll talk about the types in detail in the next sessions. The first type we'll see is the bacterial meningitis, or we call it as a pyogenic meningitis. Bacterial meningitis or pyogenic meningitis. The next is viral meningitis, and the other is fungal, then parasitic infections and non-infectious conditions also. As we previously mentioned, non-infectious causes also can cause meningitis. Uh, Sorry, I think this slide is not clear. Uh, don't worry. We'll see each and every types of meningitis in detail in the next slides. So with this, let's see the epidemiology of meningitis. In generally, the incidence and epidemiology, geographically, the epidemiology of meningitis varies. It varies by type and region, and the higher in the infants, elderly, and immunocompromised individuals, because in this group of individuals, in elderly, in infants, and in immunocompromised individuals, the risk of having disseminated infections from other sites like meningitis is usually, as you know, the commonest type of meningitis is hematogenous form, which goes from certain parts of the body infected, then disseminates to the CNS by blood, hematogenous dissemination. So this group of individuals are not able to control the infection within a specific area due to their weakened immune system. So they are at risk of having meningitis. So the epidemiology in this group of individuals is very common. The other is seasonal pattern. Seasonal pattern in some forms of meningitis. It may occur in certain seasons. In certain seasons, this map shows you that this is the meningitis belt. You see, this is the meningitis belt that occurs specifically in Africa. It starts from Eritrea and Ethiopia, then including South Sudan. It goes to through Central Africa, including the Chad, Niger, Nigeria, and then go to so Burkina Faso, and finally it goes up to Senegal and Guinea. So this is the meningitis belt where commonly the epidemics of meningococcemia or meningococcal infection which occurs with Neisseria meningitis commonly affects this meningitis belt in Africa, and commonly it causes epidemics in every certain years. Sometimes it may cause epidemics every 8 years, and it is common to see uh, epidemics of meningococcemia in this across African meningitis belt. So, if we see the epidemiology like this, the next we see is about the etiology. Etiology is, as we mentioned previously, bacterial, which is common, and in fact the serious form of meningitis. Common organisms usually Streptococcus pneumoniae, Neisseria meningitis, Haemophilus influenzae, and Listeria, which is common in elderly neonates and in immunocompromised individuals. Listeria causes meningitis. So epidemiologically, the most common bacterial etiology that causes meningitis is Streptococcus pneumoniae. Streptococcus pneumoniae is the most common bacterial cause of meningitis. The other cause is viral. In fact, Enterococcus, which is the most common viral etiology that causes viral meningitis, is enteroviruses, which is the most common. Other possible etiologies are herpes zoster virus, varicella zoster virus, mumps, and HIV also can cause meningitis. Generally, meningitis, which is caused by these viral etiologies, are self-limiting. Most of the time, they are self-limiting, and most of the time, they don't cause life-threatening uh, conditions. The other etiology we try to see is the fungal etiology, like cryptococcal meningitis, candida, histoplasma, and fungal etiologies are not common in immunocompetent individuals, especially cryptococcal meningitis, which is very common in advanced HIV infection. In advanced HIV infection, patients with HIV with WHO stage 4 usually develops cryptococcal meningitis. So fungal meningitis is not common in immunocompetent individuals. It primarily causes meningitis in immunocompromised individuals, specifically in advanced HIV infection. The other not common, but sometimes that may cause meningitis are parasitic and non-infectious causes of meningitis like amoeba, TB meningitis, autoimmune, and drugs also may cause inflammation of the meninges, and sometimes, as we mentioned previously, malignancy also can be possible cause of meningitis. In fact, TB meningitis is not rare. In developing countries like in our country, Ethiopia, TB meningitis is next to bacterial meningitis is the commonest form of meningitis, and also it causes neurologic disabilities in most of the patients who are affected with TB meningitis. With this, let's see the pathophysiology of meningitis. So when the bacteria or other etiologies could be virus or fungal infections when they invade certain parts of the body. In fact, the pathophysiology depends on the site where the individual harbors the organism. If it is hematogenous dissemination, it could be from like individuals who had pneumonia, individuals who had genitourinary system infections. The organisms may arise from there and may go to the central nervous system by hematogenous dissemination. Or in some individuals, could be due to trauma related, like for example in patients with head injury, they might develop meningitis due to local extension. Local extension. Patients with otitis media, patients with other head and neck region infections may cause meningitis by this local extension of the infection to the central nervous system, and then that may infect the CSF, the leptomeninges. So then, when there is infection, when there is inflammatory reaction, there will be a response, inflammatory response that our body responds. Then the inflammatory process will start. Then swelling of the cell is there. Then you will see increased intracranial pressure. Finally, if not treated, herniation and death may occur. And neuronal damages finally may lead to neuronal damage. And this is a risk factor. Risk factor. This is the final part of this part one lecture. So risk factors for having infection or being infected with etiologies that likely cause meningitis are age extremis. Age extremis means could be children or pediatrics age group or old age. In old age, in pediatrics, as we mentioned previously, also immunocompromised individuals, they are at higher risk of having meningitis from any kind of etiologies. Could be bacterial or viral. It could also be parasitic or TB meningitis. In extreme ages, the meningitis epidemiology is very high. The other is head trauma. We already mentioned in individuals with head trauma. If they develop meningitis, if individuals with history of head trauma develops meningitis, most likely the etiology could be staph aureus. So the staph aureus is commonly associated with head injury associated infections of the meninges. So others like neurosurgical procedures and travel or exposure. Travel to exposure, travel to other geographical areas and exposure to certain etiologies like the previous one we mentioned, the African meningitis belt, where the Neisseria meningitis epidemics is very common. Someone may acquire the infection by traveling to the endemic areas. So we'll see the part two in our next lectures. Thank you very much for this part.